Well, good morning, everybody. First of all, I wanted to say thank you all very much for being here today, and to thank our Nebraska State Patrol and Department of Transportation who have been managing through the weather. Encourage everybody to be cautious as you're out there on the roads. They can be slippery. I saw some cars as I was driving down from Omaha today that were sliding around, a truck that had overturned, so please be cautious when you're out there driving. And again, thanks to our first responders who are helping our motorists out here. Also want to express my condolences for Senator Carnes, who passed away this weekend from cancer in Boston. I want to express my condolences to his family and remember what a great public servant he was here for the state of Nebraska. As always, I want to remind people that continue to practice our good social distancing guidelines. Keep that 6 feet of distance between you and other people, wear a mask when you go to the store, wash your hands often. And then also our 3 C's. We've got avoid the confined spaces, crowded places, and close contact. The virus spreads from one person to another, so that's a great opportunity, if you can avoid those, to be able to make sure that we're slowing the spread of the virus. And of course, that's all about preserving our hospital capacity here in the state of Nebraska. Even with our increasing number of hospitalizations, we do have robust hospital capacity. We've got 34% of our hospital beds are available, 35% of our ICU beds are available, and 75% of our ventilators are available. And then, of course, another way that people can help prevent the spread of the virus is by getting tested. Everybody's eligible through testnebraska.com. We've delivered over 350,000 tests since October 13th. We've been able to turn around those tests in 48 hours or less. I think the last 7 days, the average has been about 30 hours, or about a day and a half, a little bit less than a day and a half. So anyway, great opportunity there for people to go get tested. If you're going to go see, say, your grandparents, you can go get tested. Make sure that you don't have the virus. And so today we have, and then the CARES Act program. So we announced on October 19th our additional programs for recovery from the CARES Act. The small business stabilization grants were on a first-come, first-served basis, and those have been oversubscribed. So that grant in particular has been closed. If you go to coronavirus.nebraska.gov/grants and programs, that's where you can apply for the grants and you can monitor the status of the other grant programs. Livestock is available, for example, and we still have the grant programs that are available for hotels and convention centers and ethanol plants and so forth. But I encourage people to apply sooner rather than later, as the status of those, again, the allocation for those may get oversubscribed as well, and then those will be closed. So please continue to monitor that and apply if you are eligible. So we've got a number of speakers who are going to be with us here today. We've got Angie Ling, who's our Incident Commander for the Department of Health and Human Services. Matt Bloomstead, who is the Commissioner for our Department of Education, and then Allison Bauer, who is the President of the Nebraska Academy of Physicians Assistants, talking to us about various topics here today. We're going to start with our vaccination plan for the state of Nebraska. So the federal government has asked us to put together a vaccination plan and have that submitted to them by October 16th. We met the deadline, got our vaccination plan in there. It's available on the Department of Health and Human Services website. And Angie Ling, our Incident Commander, is going to talk a little bit through what that vaccination plan includes and bring people up to date on that. So Angie, I'm going to go ahead and ask you to come up and talk to us about that.
Thank you, Governor. As we know, vaccine will play a critical role in protecting Nebraskans against COVID-19 as well as slowing the spread of the virus. The Department of Health and Human Services, local health departments, and other partners are planning for the arrival of COVID-19 vaccine in Nebraska. Part of that planning includes ensuring an efficient distribution network for the vaccine, so as soon as the first doses arrive, they can get quickly into the arms of Nebraskans. The Centers for Disease Control and Prevention released a COVID-19 vaccination program interim playbook in mid-September to assist the states with their planning, and all states were required to submit a vaccination plan to the CDC. Nebraska's plan outlines a phased approach for distribution and dispensing of COVID-19 vaccine. During much of Phase 1, the vaccine will be distributed using Nebraska's existing Vaccines for Children provider network, which includes Healthcare providers, local health departments, federally qualified health centers, community-based clinics, tribal healthcare, and hospitals. We expect that vaccine supply will be limited early on, and initial doses will go to healthcare personnel and critical populations. We have broken phase 1 into 2 parts, anticipating different levels of vaccine availability. Phase 1A includes healthcare personnel and hospitals, emergency rooms, long-term care staff, urgent care, and primary care access points. Phase 1B includes residents of long-term care facilities, people 65 years and older, people with certain underlying medical conditions, essential critical infrastructure workers, which can vary by local jurisdiction, and vulnerable populations and congregate populations. As supply increases, more people will be able to receive vaccine, and more providers will have access to order and administer the products. Despite the many unknowns that still remain in planning for vaccine distribution, DHHS has worked to ensure that inclusion, transparency, and a sound evidence base are the foundation of our plan. The plan is a living document that will be revised as new information is available. I want to take a moment to recognize and thank the team leads, Sarah Morgan and Jerry Weberg-Bryce, and our many planning partners, including the local health departments, tribal health, and FQHCs. We haven't received notification of an expected arrival date for vaccine, but when we do, our goal is to ensure fair and equitable access and distribute the vaccine in a way that provides the most protection for Nebraskans as quickly as possible. You can find the COVID-19 vaccination plan on the DHHS coronavirus website at dhhs.ne.gov/coronavirus. Thanks.
Thank you very much, Angie. I know that people are anxiously waiting to get those vaccines. So we'll certainly continue to give more information as we receive it here at the state with regard to the status of that. Next, we're going to have Commissioner Blumstead come up and talk about the GEARS Act funding. This is the part of the CARES Act that is providing dollars for our education. And in particular, one of the things that the Department of Education did is they did a survey of digital capability for folks throughout the state, looking at our K-12 schools, both public and private. I think you've also engaged homeschoolers as well with regard to that. And that's helped structure what the state of Nebraska is doing with regard to our GEARS Act funding. We've got about $12.5 million that we're targeting toward folks to really be able to make sure that people have that digital access. In the survey, I think the need was about 29,500 devices. Is that about right?
I think that's about right. You're
Yep.
all gonna get to that.
And there is a availability of about a $400 subsidy for that to be able to get folks to be able to make sure they have access to those that digital learning, especially as we make adjustments during the pandemic here. So with that, I'm going to call Commissioner Blumstead to talk a little bit more about the GEARS Act funding.
Thanks, Governor. And really, I think as the available funds from various different sources out of the CARES Act, the governor had reached out to me and immediately started to say, how can we best coordinate? So I do very much appreciate that. I know underneath kind of our plans, as we looked at the available funds for schools, there are other funds that are going directly to schools, a few funds that are reserved for the department, and then the GEAR funds. It's actually, I think, with all the acronyms, it's Governor's Education Emergency Relief Fund. And so with that particular fund, the governor really began to focus on how to address the digital divide. Obviously, as we entered the spring and had to go remote in so many places, we found a huge need for devices all across the spectrum of our educational providers, and really do appreciate that kind of coordination. From the application of the GEAR funds, and at that time, the department did, as the governor mentioned, kind of do a needs assessment across the state and looked at really what the various needs were, and the governor hit it like right on the head. It was 29,524 devices that were needed, and we really got to the sense of it's actually actually a kind of a tough moment in time to go order devices. And so you have to kind of be able to put yourself into the supply chain to get some of that done. And so we've actually gone out and worked and addressed the $12.5 million that's available for those devices, aligning it with those needs. And we actually have orders out there for many of the entities that we talked about, non-public and public schools alike, to make sure that that can be done. We've been partnering with the Educational Service Unit Coordinating Council to make sure that we can get those orders done and put those in place. And of course, depending on the type of device, the availability for those devices is actually coming forward actually very soon, in the next month to 3 months. I will say certain devices have much more of a back order than others, and so that's proving to be a bit of a challenge. However, as we enter the winter, it's pretty obvious that there's all the more concerns about where we may be with education. We're hoping to keep students in person as much as possible, but we actually do believe that these additional devices are going to be quite helpful for our schools to both keep them open and keep them moving. And I was going to joke a little bit about a snow day. I had a lot of school officials ask me if there are going to be snow days in the future, and I suspect this is proving up the point there. I saw some schools that were delaying their starts today, but the reality for us, I think, as we go forward is we're going to see more and more of that technology. We've also worked with the Office of the Chief Information Officer underneath the governor and education and ESUs and many other partners to think about what's that whole hierarchy of needs that we see for education. And it really goes through the dynamic of infrastructure and devices and software systems, digital content, and then ultimately even professional development and training. And so as we kind of go from the top of that list down to the bottom, the reality is that infrastructure piece, the governor's actually invested other funds from other sources to make that possible. I think it's going to be really important for Nebraska, but really across the country, to make sure that we have as much availability of internet access and high quality internet access, as well as devices, as well as high quality instruction. Our schools have done a great job of really trying to focus in on what's most important right in this moment, giving students and parents and that connection. And it's a challenge. We've heard of the challenges of trying to teach in a hybrid environment. So we'll continue to do that work, looking at where we can take these investments and build on those, and hope to coordinate that activity as we go forward to, number one, keep learning happening in our schools at this critical point in time, but also be able to stabilize that environment regardless of the situation that might be happening at the school. So I appreciate that. I appreciate the opportunity to be here, and we certainly have more information available at our launchne.com website that gives a little bit more about the background on this technology. So thank you, Governor, and I appreciate always the opportunity to be with you.
Thank you very much, Commissioner, but you kind of left us hanging on the whole, will there be snow days in the future? If we actually... Oh, so he's not going to give us an answer. So like if we get like 6 inches of snow, kids are going to maybe have to stay home and continue to work? They're not going to like be able to just take it off even if they've got that tablet to do schoolwork on?
Road conditions will make snow days. Whether or not you have to work at home is going to be the issue.
Right. So as a kid, that's what I want to know. Can I go out sledding, or do I have to stay in and work on my tablet?
It would be more popular to say we're going to have snow days in the future.
Okay. You would be more popular if you said that with certainty there'll be snow days in the future, but I'll leave that for a future day. All right. So thank you very much, Commissioner. As I mentioned, our third speaker is going to be Allison Bauer, who is the president of Nebraska Academy of Physicians Assistants. We also have in the audience with us Kathleen Tonkin, actually we had 3 certified physicians assistants that are in the audience. Kathleen Tonkin, who is with Southeast Nebraska Cancer Center here in Lincoln. Kathleen, there are you? Okay, great. And then Bethany Berg, who's the University Health Center here in Lincoln. And then Bethany's right there. And then Sean Horak, who is the University of Nebraska Medical Center. Sean, where are you? Sean's right back there. Great. Great. Thank you all very much for being here today. So October is Physicians Assistants Month. And first of all, I want to thank Allison for being very flexible as we've had to adjust the schedule to be able to get this proclamation signing in. And so thank you very much. We did get it in here before the end of the month, so that's a good deal. Also, I just want to say thank you to all the physicians assistants out there. You know, first of all, just in general, I love working with physicians assistants because they give you very practical advice about how to take care of yourself. They're on the front lines. They're dealing with people every day. So, you know, just in general, they do a great job. And then certainly during this pandemic, they have been on the front lines in helping to keep people healthy during this pandemic. There's been new safety protocols. Everybody's had to get used to those and adjust. And so physician's assistants have been really key in being able to make all that happen. So I want to thank the physician's assistants that are not only here in this room, but all across the state for all their great role in helping keeping us healthy, whether it's coronavirus or anything else that we have going on. And so before I call Allison up here, I'm going to go ahead and sign this proclamation that will declare it Physician's Assistants Month in Nebraska. So Allison, if you'd like to come up, I will present this proclamation to you on behalf of all physician's assistants.
Wonderful.
Right. And I will turn it over to you.
Thank you, Governor.
Thank you, Governor Ricketts. We're pleased to be here with you today. We appreciate you recognizing the PA profession in Nebraska. I am Allison Bauer. I currently serve as the Nebraska Academy of Physician Assistant President. Our academy represents PAs throughout the state and provides them with educational and professional opportunities. We also count the students of PA programs at Union College, University of Nebraska Medical Center, College of St. Mary, and Creighton University as members of our organization. These young leaders will be the future of our profession and quality healthcare in Nebraska. Physician assistants provide a valuable service in healthcare community, working side by side with physicians to enhance and deliver high-quality care for patients, often in medically underserved and rural areas. PAs are often the first point of contact for patients and play a vital role in helping patients understand their medical needs and become advocates for themselves. Thank you for recognizing this month for us PAs. This continues to show that we have a significant impact and continue to make in healthcare and expand awareness of our profession and salute the outstanding growth of the PA profession. We would like also to thank you for modernizing LB 755 into law, modernizing our PA practices. This legislation amends current statutory language, ensuring PAs can prescribe non-pharmacological interventions such as durable medical equipment and other services such as hospice. PA's ability to practice in geographically remote areas from their collaborating physicians is also clarified in LB 755. NAPA is thankful for Senator Williams, DHHS, and our fellow provider association leadership in getting this legislation passed. It was a real team effort, much the way we deliver excellent health care here in Nebraska. We appreciate having a governor who understands the vital role PAs play in local communities and for quality health care, and celebrate this win for patient care in Nebraska. Governor Ricketts, thank you again for highlighting PA Week and recognizing all PAs in Nebraska.
Great, thank you very much, Allison. And for the PAs in the audience, after we get done with the press conference, we'll just stick around, we'll take a quick picture up here with some of the other proclamations. All right, with that, we'll go ahead and move into questions and answers. Taylor, where'd you go?
Right here.
All right, Taylor.
Anderson from the World Herald would like to know, how will a vaccine be allocated to the states? Is it by population or some of the venture?
So the question was from Julie Anderson at the World Herald, how will vaccines be allocated to the states? Will it be by population or some other method? And Angie, I don't think we know that yet, do we? No, we don't know that yet. So I think we'll all just have to kind of stay tuned. Again, while we had to submit our plan to the federal government this month, we're not expecting probably to see the first vaccines, and there's several of them that are going through phase 3 trials right now, but we're probably not likely to see those till the end of this year or early next year. So there's going to be more details to come with regard to how those will be distributed.
And then she also would like to know, we may have said something about this before, but will vaccines be free for people?
So the question is also, we may have said about this before, but Julie Anderson wants to know, will the vaccines be free? And my understanding is absolutely yes, the vaccines will be free for everybody to be distributed.
Don Walton from the Journal-Star says he has a question about the Trump rally tomorrow. He says people won't be socially distant. Should people wear masks at the Trump rally?
So Don Walton of the Journal-Star was asking about the Trump rally tomorrow, saying people won't be socially distanced or they wear masks. First of all, I would say, never heard any questions like this when we had the rallies that were in June. So don't know that we need to comment on that right now, but I just encourage people to follow the rules like we always do. Anything else?
That's all. Yeah.
Okay. Questions from inside the room? Andrew?
You've answered this before, but about whether vaccines should be mandated or not. How will you handle that in the state? If it's up to the states, and how do you think it should be handled?
So Andrew is asking, will will vaccines be mandated, and how will the state handle it? And again, we're not planning on mandating this broadly from the state level. We think that this is something that people should adopt, and part of what the federal government's doing is communicating and educating people with regard to the safety of the vaccines. For example, they're doing trials with 30,000 folks in the phase 3, which is significantly above the 5,000 you would normally do, in an effort to be able to make sure that we can move along the phase 3 trials as quickly as possible. So again, my anticipation is that there'll be a lot of education with regard to the vaccines, but it will be voluntary whether or not people want to get a vaccine. Yeah, Martha.
So Angie was saying that that the vaccines will be distributed through the network for children's vaccines, but the target population is not children, so will there be any disconnect in that?
So the question was, what Angie Ling talked about was that VFC, which is the Vaccines for Children, which is the structure we usually do for all vaccines, is going to be the structure we use to distribute the vaccines. However, they will not be targeted at children, at least primarily. It'll be for everybody. Is there going to be a disconnect there? And no, I think it really just gets to, that's going to be the structure that will get out the vaccines to the fairly qualified healthcare clinics and everybody else who's going to be distributing them. But Angie, I'd certainly have you come up if you've got anything else that you would like to add in addition to that. Okay. This is not Angie, though.
Hi, I'm Jerry Weberg-Bryce, and I'm the Immunization Program Manager. So the Vaccines for Children program, you're correct. It normally does vaccinate children from the age of 6 months to 19 years of age. However, since this vaccine is for adults, what the CDC directed us to do was seek what we already know, seek the infrastructure that's already there. And so that's why it's coming through the VFC program. Storage and handling and other practices are something that these VFC sites already know. And so that portion of any type of training or onboarding wouldn't have to take place. So it just kind of makes it an easier transition. There are other groups that are not necessarily with the VFC program that we're having to onboard, and so those existing partnerships really have helped us pick up this load.
Great, thank you.
So does this plan have to be approved by the feds, or is this the way it's going to be?
So the question is, does the plan have to be approved by the feds, or is just the plan we submit is to kind of just make the feds aware of it? Angie, what is the specific with regard to that? Do you know, is this? You might as well just stay up here.
So the plan is a living draft, and what the CDC has done periodically is provide us with updates that they're getting from their end, and they realize that since this is an evolving situation, that it's a living draft. And so when we did submit our plan, it was in a draft form. It is a living document that changes every time we get new information.
So do the feds have to approve it, or?
And they did not approve. What they did was they read through it, making sure that we're hitting all the key points, and then providing us with feedback when they have it.
Have they done that yet?
They have.
Is there anything likely to change?
No. Nope, we're pretty much on track.
Also, I see that there are provisions that offer liability immunity, but then there's also a provision that looks like for reimbursement if somebody has a bad reaction. Can you say how that will work?
I am not being made aware of the financial side of it, just because the Vaccines for Children program is a free program. So if there is an adverse reaction, there is a website within the plan that people are directed to go to and can kind of pick up that information from there. Yes?
Are there any plans for, like drive-through, inoculations or anything like that?
Sure, like satellite.
Repeat the questions, because for the microphone.
I'm sorry. So he asked if there were any plans for doing some satellite clinics. That would be something that we are planning for once the vaccine becomes more readily available. When it first comes out, it's going to be really limited, and we need to make sure that those healthcare providers are vaccinated first so that they can provide those drive-through clinics once we have a little bit more vaccine.
We have a question from Grant Schulte. He wants to know, how long will it take to get everyone vaccinated?
Oh, well, that's a really good question, Grant. We're really not sure. I'm sorry. Grant wanted to know how long it would take to get everyone vaccinated. And we really don't have that information at this time. We really don't.
Martha's got a question.
Martha?
So how will people know if they're in one of the groups that would be able to get the vaccine early? Obviously, if you work in healthcare, you may have some idea, but otherwise, not necessarily. And then when this, you described phase 1, but is there another, does it go then from phase 1 to everybody, or is there another group in between?
So how will you know if you land in phase 1A or phase 1B? That will be through communications either at the state level or a local level. And what was your second question?
Beyond phase 1, what are the phases?
So beyond phase 1, we have phase 1A, and then phase 1B, and then phase 2. Phase 2 is when we're going to see a lot more vaccines, so that's really going to open it up to the general population. And then we're looking at, phase 3, really just more extending providers, extending our reach. But that's kind of, down the road. That's really looking ahead.
And have you been told who will pay for this? Will the federal government pay for this, or will the states be responsible for picking this up, or?
So the question is, who will pay for the vaccine? The vaccine is free, and it's been secured by the federal government.
So the federal government will pick up the tab?
Yeah, they have purchased these vaccines from the different companies. That's kind of the risk that they've taken to make sure that everybody is healthy and safe. So there could be an administrative charge, and we don't know the mechanisms for that yet. Those are still under construction by the federal government.
So we don't know if the administrative charge will be covered, will be free to participants?
We don't know. It depends on where you go to get it. So it would really depend on where you go to get it. If it's a VFC site, a place that is normally operates using or providing services for somebody who's uninsured or underinsured, they're used to not picking up the administrative fee. They're used to not receiving that. However, if it's a corporation or a business, then you could see some billing for the administration fee, either to your insurance company or to the individual if they're not covered. But where the program is coming from, absolutely we encourage folks to just give it for free. Just give it for free, don't charge the administrative fee. However, we really don't have that kind of reach in the private sector.
And I don't, either you or the governor, what would you tell people that say, I don't want to be the first one to charge the hill, I want to see how this thing goes? What would you tell those people?
So the question was, folks who are hesitant, they don't want to be the first to charge the hill, what would we suggest to those individuals? And I don't know if you want to take this, but from my perspective, I understand and I hear what they're saying. I hear their concerns, and I want to be respectful of those, as do the rest of the providers in the state of Nebraska. We want to look at the science, and we want to look at what's best for Nebraskans. And so I think that those conversations are something that need to take place within the patient and their provider. That's what I would encourage them to do, is speak with their provider.
All right, thank you very much. Other questions? All right, seeing none, I'm going to go ahead and wrap it up here. But again, thank you all very much, and remind people to continue to follow our rules with regard to keeping that 6 foot of distance, washing your hands often, wearing a mask when you go to the store, and avoiding the 3 Cs. Those will all be things that we can do to help slow the spread of the virus here in our state and preserve our hospital capacity. Thank you all again. So later on this week, obviously, we mentioned that there's going to be the Trump rally tomorrow night. And then on Thursday, right, Taylor, we're going to be going to David City to award the Blue Ribbon designation to the David City School. So very exciting opportunity there to be able to recognize the excellence of education here in our state. So thank you all very much, and we'll talk to you later in the week. And now, if our physician's assistants can come forward. Taylor, if you could move the podium. That off there for you. Come on, Kathleen, don't be shy. You, and definitely one for you. Sean, we got one for you. Thank you so much. Down us out a little bit.
Try one with the flash first, are you ready? All right, smile. And then just in case, I'll close it.